What exactly is situational anxiety? Now, I remember reading something that you'd either written or done a video about, and I thought it was so interesting because a lot of times we think that, like, we hear the term anxiety, it's like this one term, and it sounds like you either have it or you don't have it, right? But the way you explained it is like not so much, right? So situational, what is that?
Okay, so let's start by talking about diagnosis.
Sure.
So just one of the main jobs of a psychologist, and that's how it would differ, say, from a counselor or a social worker, is differential diagnosis. Mm-hmm. And so what tends to happen is we are overrun by information right now. And so everybody's walking around self-diagnosed with anxiety.
Right.
And whatever it is, whether it be that when we were younger, it was depression. I'm not saying depression isn't out there, but anxiety is what everyone's talking about now. You walk down the hallways of our schools that we work at, it's stress and anxiety become one and the same. Yeah. And what you brought up is a really important point, is nothing is either one way or the other. Nothing is either all one thing or all. The way I look at it is it's on a continuum. So the thing about situational anxiety is every single one of us, 100% of the population experiences situational anxiety every day. If you're pushing yourself, if you're trying something new, then that's going to be some anxiety. But at the same time, it could be the other side of it. You don't have the skill set. And so your whole entire life, you've been protected from failure. Failure, which is a very natural part of life, happens. And you're absolutely devastated. That's not anxiety. That's just failure.
Right. It's different funny, word. But yeah, that's
so right. Yeah. And so with stigma, which is I love your mental health matters. There's like ending stigma and everywhere it's all about ending stigma. But the problem with that is that all of a sudden everybody's being lumped into one category, so that people that truly have a diagnosis don't get what they need. So So situational anxiety is really another word for fear and trepidation and difficulty coping, any of those things. And situational anxiety, so when you talk about a continuum, is that today, like for example, when I did my TEDx talk, my situational anxiety was 100.
Right.
Right. So part of really the coping that we'll get to, before I came on with you today, I would say my situational anxiety was about a 70.
Oh, really?
Yeah, but I like it.
Oh, okay.
I like it. Because when we talk about flow, so you might have seen my flow video, is that the really situational anxiety, if you reframe it, could be the opposite of boredom.
Okay.
Right. So it's about the words that you use. So situational anxiety is a normal everyday experience. And whether it goes from situational anxiety, which I would just call stress, and an anxiety disorder, is your ability to cope, what your biology is, how much sleep you've had, all those different things. So I think we really need to normalize situational anxiety.
Yeah, so I wonder if it would be, I like that you talk about this, it depends on the words that you use, right?
Yes.
I was just talking to my husband's wife literally yesterday, because we were talking about all these different terms, and he was saying there seems to be like an over-diagnosis of everything. Like everybody has everything. So I have to just say publicly, if it makes to the edited video, you were a little bit right, Dwight. So I'll put that there. But I was telling him that I noticed that with the word depression, right? Like people, I know what you mean. Like that was the word for our time, right? People would say they were depressed, and I think really they were just sad.
They were sad, and that was a normal reaction to a loss.
Right.
That's a normal. So what makes the difference between depression and say sadness is that someone who's depressed doesn't need to have a loss.
Right.
So they can wake up in the morning, they wake up in the morning, they have everything, but they feel nothing. So I think of depression like not enough stimulation, and anxiety like too much stimulation.